Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Last week, the province announced that as of March 21st, Ontario will remove the mandatory masking requirement for most settings. We'll speak about this more in a moment, but I think it's important to note that some of the most significant changes over the last 2 years have occurred over the last few weeks. And with this change coming next week, people have a mix of relief and fear. But in some ways, these changes are not as significant as we think. Yes, we are now permitted to gather and shop and eat almost as normal. And yes, the mask mandate will expire shortly. But that doesn't mean that we'll be dropping masks or that we need to gather all at once. Gradual change is the name of the game, and moving slowly is important for each of us mentally and for all of us as a society, and it's also the best approach for preventing a pandemic resurgence. You can and are encouraged to still wear a mask in most settings, particularly in crowds, confined spaces, or when close to others. You're just not mandated to do so now. The COVID-19 pandemic is not over, and COVID-19 is far from endemic. Some metrics are pointing in the right direction, while others are worrisome. In Ontario, our wastewater signal is stable, our hospitalizations are stable and decreasing slowly, but deaths remain persistently high, and our positivity rate increased this past week. If we look across the pond, many countries in Europe are seeing increasing rates this past week. This is something we're watching with concern. The upcoming removal of the mask mandate in most settings still requires masks in public transit, in hospitals, in other healthcare settings and congregate settings, as well as in several other scenarios, depending on your personal circumstances. You will need to mask up if you're recently returned from out of country or if you are a contact of a case. Please note that household contacts who are vaccinated and boosted, that is 3 doses, no longer required to self-isolate, but they must also wear a mask at all times in public indoor settings. Please consult york.ca for details of these changes. Please remember, though many of you are enthusiastic to remove your mask, there still will be many who are fearful and uncomfortable with this change, especially those who are most vulnerable or who are immunocompromised, or those living with someone who is. We continue to encourage mask wearing indoors out of consideration for others and strongly encourage masking if you are in areas with large crowds, in poorly ventilated spaces or confined settings, or in places where you will be in close contact with others. For the next several weeks, please do carry a mask in your pocket so you're able to protect yourself and others when appropriate. Above all else, remember to be kind and considerate as we all navigate this new phase of the pandemic. With almost all control measures now removed, including masks, vaccination is our one best defense against COVID-19. Third doses are critically important for everyone above age 12, and new data from last week confirms what we already knew, that immunity from a second dose against infection wanes after just 2 months and almost completely after 3 to 4 months. However, 2 doses do provide good protection from severe illness, but a third dose boosts this protection to 95%, according to Ontario data. To protect children as they return to school after March break, it is critical that they be vaccinated. This week and through March break is a great time to get your child vaccinated or to get your booster. Visit york.ca/COVID-19 vaccine to find a vaccine clinic near you. Speaking of March break, as a reminder, for those traveling and gathering over March break, please carefully monitor yourself for any COVID-19-like symptoms, and do test if you have access to a free government-provided test or another antigen test. And do stay home when sick to protect your loved ones, classmates, and the community. If you have traveled internationally, you will need to wear a mask for 14 days upon your return when you're in public indoor settings. Though spring and summer are approaching and look very positive, we need to remain cautious, stay safe, and of course, get vaccinated and boosted if you haven't already.